when I was 36, I started noticing fatigue that wasn't quite normal for me, and also an irritability that was not normal for me. And so I decided I would go talk to my gynecologist about it to see, if something might be going on, maybe he could give me some guidance or some help. And he was very candid with his explanation. And he said, Angie, everything that you're explaining to me right now is hormone related, but I don't have time to learn all of that hormone stuff. I'm busy delivering babies and performing hysterectomies, and there's just too much involved in hormones. And I appreciated his honesty, but I thought, if you can't get good, solid information from your gynecologist about female hormones, who in the world do you go to? So that sort of began my quest for learning more about hormones. It was really out of necessity to help myself. And so I started attending courses and learning as much as I could, just really so that I could improve how I was feeling at the moment. Now, the more that I learned about hormones and the long-term health benefits that they provide, then the focus really became about trying to age as strong, age as healthy, and delay degenerative disease as possible. I worked in healthcare in the clinic or a hospital pretty much. It's when you said 30 years, I'm like, wow. It's really for about 35 years now that I've had worked in a clinical setting, seeing people, in the throes of really devastating disease, and that was robbing them of a good quality of life. And I just thought, I don't want to end up like that.
Mhm.
So what can I do to delay that
Mhm.
or prevent it? And hormones really are so important in being able to do that. There's some things that are beyond our control, but if we combined hormone therapy with healthy nutrition, adequate exercise, and of course, other lifestyle factors, stress reduction, adequate sleep,
Mhm.
then we can dramatically affect or influence how we are going to age. And so we continued to learn more. My husband sort of had the same journey of his own. We started attending courses together and learning as much as we could. And once we started feeling better, the people around us would notice and they would ask, what's going on? What are y'all doing? Something seems different.
Mhm.
And so we really started treating our friends and colleagues just alongside of his spine and sports practice. But it was never anything that we really intended to do as a primary practice.
Mhm.
It was just sort of a passion that we had.
Mhm.
And so it just sort of snowballed from that. Once our friends and colleagues started feeling better, they would ask if we would see their friends or their family members. And then we would see them. And then it just started growing from there until ultimately in 2019, Keith retired from practicing spine and sports medicine to full-time preventive medicine, specializing in hormone therapy. So we started the practice in 2011, but went full-time for him in 2019. And then, of course, COVID hit. And so everything at that point went via telemedicine. So we're located in Chattanooga, Tennessee. And it's just really all that we do. We eat, breathe, sleep, live it.